So dental implant cost, this must come up all the time. So what affects the cost when you give people upper or lower set of teeth supported by implants?
Yeah, you know, Randy, every day some people call the office and ask about cost of dental implants. And it's a confusing concept. There's a lot of factors that go into what does your dental implant restoration, your teeth, your smile, what's it going to cost? You know, I've identified several factors, maybe 8, 9, 10. And the first one is the dental implant itself. You know, what do we pay for a dental implant? At our office, we might pay a minimum of $450 for a dental implant. And, you know, implants are different. There's implants that are shorter, there are implants that are larger, longer, there are FDA approved implants, there are non-FDA approved implants. Some patients might need special implants that might cost as much as $800, $900 an implant. And what we see though, in the marketplace, we see some offices advertising that you get dental implants for, say, $900. So when we see those costs advertised online, we know that it's misleading. And if the office is misleading on one topic, what else are they going to be misleading about?
Okay.
So another issue is the number of doctors involved. You know, it's typical for a patient to go one doctor to one office to place the implant, another office to put the teeth in, and a third office to maybe maintain it. But here at our office, we do it all under one roof. So we're able to give you one estimate right out the door.
Like one doctor, one fee.
One doctor, one fee, one location, and there's not going to be anything else added in the future. Another issue is the amount of surgery that's needed. Some people call us and we don't know what they need. Some people need bone grafting. Some people might need to see a specialist. There are all kinds of scenarios. And imagine that you're trying to figure out the cost of your dental implant and you have to go to 1, 2, or 3 different offices to find out the cost. Again, if you come in to see us, you get the whole picture right there.
Okay.
We know everything that you need, and you get a straight, honest answer right out the door. Another issue is the lab bill. Now, there's a lot of people in the country that are advertising doing full mouth teeth. And a lot of them, many of them, have a laboratory that's off-site. It might be across the city, across the country.
So that's a big expense for the doctors.
It might, yeah, it's a huge expense for the doctors. What we did here at Full Implant Choice is we brought the lab indoors. We brought it to you. So we're able to save money on the lab bill and pass those savings on to you.
Okay.
Another issue is insurance coverage. You know, the short of the insurance is that insurance is only going to cover $1,000 or $2,000 a year max.
Okay.
And it's built for preventative care. It's built for cleanings, it's built for fillings, maybe a crown here and there. It's not built for full mouth, for doing a full set of teeth. And many patients don't even have implant coverage at all. So what we've done is we've taken your full mouth treatment, we've bundled into your treatment into package pricing. We've already taken a big percentage off the top to make it really simple for you, so you can just see what's the cost of my new teeth. You won't see individual teeth listed and itemized. You know, I call it nickel and diming. You know, if one tooth costs $3,000, 28 teeth in my office is not going to cost you 28 times $3,000 or $4,000. We've lumped it together into one fee to make it more affordable for you.
You have payment plans too, right?
Absolutely. We have payment plans. We have a friendly, helpful staff that can help you get those set up. And you know, we want to see you be able to get the smile that you deserve at an affordable price today.
So Medicaid, Medicare doesn't really cover this.
We treat many Medicaid, Medicare patients, but no, it doesn't cover that.
Okay.
Payment plans that we can set up for you will help you get your teeth.
Very nice.
Another issue is materials of teeth. You know, the public needs to know that all teeth aren't made out of the same thing. You call to get a price on dental implants here, and they're different prices, maybe the same price, but they might be completely different teeth. You have to ask, what will my teeth be made of?
What are they made of?
At our office, your teeth are made out of zirconia, the strongest material that's out there. Other offices might make it out of plastic or PMMA. Look, you want something that's you can feel confident with. When you're out with your friends and your colleagues, your coworkers, your family, and you're having lunch, and you're biting into an apple or corn on the cob or salad with cucumbers and nuts, you want to know that your teeth aren't going to break. You want the best material out there, not just the best material, the strongest material, but the one that's cosmetically the best. You don't want your teeth looking like a denture.
And it doesn't cost more to do it this way, you say.
Not
like really, it's about the same, whether it's an acrylic or plastic or zirconia teeth.
It really doesn't cost more to do it this way. We brought the lab into you so we can pass the savings on to you. Now, another issue is a big one, the warranty and maintenance. A lot of places they're putting the teeth in, but they don't have anywhere to maintain it. You want to ask, who's going to maintain my teeth after they get done? Because that's important.
You warranty the teeth?
And warranty as well. For full fixed mouth, full set of teeth on zirconia, we warranty your teeth for 5 years. So you want to ask, who's going to do the maintenance, and how long is my warranty or guarantee. Now, another issue, snap in, snap out teeth. Patients call offices all the time and they say, how much for 4 implants and a set of teeth? What they might be quoted is snap in teeth. Those teeth that they go click in, click out.
You're not a fan of those?
You know, we can make them, and we can make the best ones out there, but we have found that patients don't generally have the same level of satisfaction.
They don't like
snap in and snap out teeth. No.
Because it's still a denture?
It's still a denture.
Okay.
And they still have to take it out, put it on their nightstand at night, and they got to get up before their significant other, and they got to put it in their mouth before they get seen. And while they're eating at restaurants, they got to excuse themselves, say, I got to go use the bathroom. Not to use the bathroom, but to take the denture out and rinse out all the food underneath it. So we don't really like those because patient satisfaction.
Okay.
So you want to know, am I getting snap-in teeth or am I getting teeth that don't come out?
All right.
And the last one's a big one, probably the biggest one. The experience and the training of the doctor and the team doing it. Look, at Full Implant Choice, we do this treatment every day. We don't just do this treatment 3 times in our whole career or 3 times a year, 3 times a month. No, we're doing this 2 or 3 times a day. On any given day, you walk into our office, chances are there's somebody in the office at every stage of treatment. So at any time in our office, we can probably find 1 or 2 patients that you can talk to about their experience. Look, experience matters. You know, I was young and naive at one time too. You know, I made mistakes, I had to start somewhere. Everybody starts somewhere, as long as you know that, where the doctor is starting. But you know, I've been at this for 20 years. We do hundreds of smiles a year. We have a team, not just me, but my team. Look around, watch our team, how proficient they are at doing this. They all know their job.
Is this true that, I mean, at some offices, it may take up to 2 years to get your final teeth, and you're doing it, giving them fixed teeth that don't come in and out in as little as like 3 or 4 appointments?
As little as 3 visits.
Okay.
And teeth, within 1 day, you know, we can make you a set of teeth.
So when they call your office and say how much are implants, it's like there's more to it than just that. So I guess the catch is they got to come in.
They got to come in.
Just to at least get looked at.
We got to see what the problem is. But you know, there's so much more than just price. I mean, first ask about experience, ask about warranty, guarantee, ask about the lab, ask about the, you know, how many doctors are involved. And you know, you've got to come into the office so that we can meet you and we can see what your problem is, and then we can give you a definitive fee. 1 time, 1 location, 1 price, 1 doctor, 1 office.